On the 9th and 10th January 2020, Nepal Public Health Foundation organized National Conference based on pesticide and health with the objective to disseminate national and international evidences of public health impacts and multi-sector responses towards the issue of pesticide use in agriculture farming. Pre-conference plenary session was held on 9th of January on the topic Pesticide Use, Issue, Relevance and Context with the chairmanship of Dr. Badri R. Pandey. Professor Dr. Sharad Onta was the moderator of this session, followed with keynote talk on why do we need to talk about organic farming by organic farming activist Mr. Krishna Paudel.
ले चाहिँ हाम्रो जमिन वातावरण हैन अब हाम्रो सबै चीजहरु चाहिँ तहस नहस हुँदैछ र अर्को चाहिँ हाम्रो माटो र स्वास्थ्यमा चाहिँ एकदमै प्रतिकूल असर परेको छ। त्यसरी हेर्यो भने के देखिने रहेछ भने हामी आज जे समस्याहरुका बारेमा चुनौतीको रूपमा कुरा गर्छौं त्यसको मूल जरो फेरि पनि खानेकुरामा छ।
Panelists of the pre-conference session were Professor Dr. Avinav Vaidya, Project Coordinator of FHEN and PHF, Mr. Chandra Prasad Adhikari, Organic Movement Activist of Chitwan, Dr. Khurshid Alam Haider from WHO Country Office, Nepal, Mr. Mahendra Prasad Shrestha from Ministry of Health and Population, Mr. Parshuram Adhikari from Plant Quarantine and Pesticide Management Center, MOALD.
ले कहिल्यै कसैको हित गर्दैन, यसको प्रयोगलाई निरुत्साहित गर्नुपर्छ र हाम्रो जस्तो देश संसारको एउटा नमुना प्राइमेरी कृषिको देशको रूपमा रूपान्तरण गर्न सकिन्छ।
WHO has taken a resolution in the World Health Assembly, 63rd World Health Assembly, resolution number 26, which speaks about the member states should develop the policy regulation to safe handle obsolete pesticides and to develop capacity at all levels.
अहिले चाहिँ संसारभरि नन कम्युनिकेबल डिजिज भइरहेछ क्यान्सरको अहिले प्रत्येक 6 जना मान्छे मरेको ठाउँमा 1 जना क्यान्सरको कारणले मरेछ। हामीले भएका यिनी खाद्य पदार्थहरू हामीले प्रयोग गरेका केमिकल्सहरू यसको र्याम्पेन्ट युज
आउने दिनमा मैले के देखिरहेको छु भन्दाखेरि हाम्रो एउटा स्लोगन आउनु पर्यो के भन्दाखेरि इट राइट नेपाल भनेर। हामी के खाँदैछौँ हामी सही खानु पर्यो।
अझै पनि हामी विषादीको आयात गर्न फेरि प्रयोग गर्न अनुमति दिइराछौं र हामीले बढ्दो जनसंख्यालाई खाद्यान्न पुर्याउनलाई विषादी नै चाहिँ एउटा माध्यम हो भन्ने हाम्रो दिमागमा त्यो बसिरहेछ छाप।
This conference was inaugurated by the Chief Guest Honorable Agriculture and Livestock Development Minister Mr. Ghanshyam Bhushal. Special guest on this inaugural session was Honorable Member of National Planning Commission Dr. Usha Jha, whereas guests were Honorable Dr. Ramkumar Adhikari, Member of Parliament Province 3, Mr. Khagraj Baral, Secretary, Ministry of Health and Population, Mr. Krishna Kumar Dalakoti, Chief District Coordinator Committee, Chitwan, Mr. Khum Narayan Shrestha, Mayor of Kalika Municipality, Chitwan. Welcome remarks was done by Dr. Mahesh Maske and vote of thanks was paid by Professor Dr. Sharad Onta.
1950s तिरको कुरा हो हाम्रो देश त्यतिबेला भर्खर राणाशाहीबाट चाहिँ मुक्त भइरहेको थियो अनि उहाँहरूले त्यो अभियानलाई ग्रीन रेभोल्युसनको नाम दियो। पहिला मेक्सिकोबाट सुरु भयो त्यसपछि त्यो भारतमा त्यसको प्रयोग गरियो र त्यो प्रयोग यही भएको रासायनिक मल पेस्टिसाइडहरु हैन अनि यो हाइब्रिड बीजहरुको कम्बिनेसनबाट यति धेरै मात्रामा चाहिँ हामी उत्पादन बढाउन सक्छौं कि त्यसले चाहिँ ठुलो ठुलो भुखमरीहरुलाई कन्ट्रोल गर्न सक्छ हामीले चाहिँ एकदम समृद्धिमा जान सक्छौं भन्ने नै त्यो एउटा स्थापित चाहिँ मेनस्ट्रीम थिंकिङ त्यो बन्यो तर त्यो बनिसकेपछि त्यसको साइड इफेक्टहरु चाहिँ हामीले धेरै पछि मात्रै थाहा पाउन थाल्यौं।
चितवन जिल्लामा भएका विभिन्न व्यावसायिक कृषकहरु र हरेक वर्गका किसानहरुलाई अब हामी विषादी नियन्त्रण गर्नुपर्छ, विषादीलाई बिस्तारै कम गर्दै जानुपर्छ। यसले पार्ने मानव स्वास्थ्यमा पुर्याउनेले हानि नोक्सानीहरुको विषयमा हामीले किसानहरुलाई सचेत गराउनुपर्छ, उपभोक्ताहरूलाई सचेत गराउनुपर्छ भन्ने उद्देश्यका साथ अब कुन शब्दले बयान गर्नु हामीले नेपाल जनस्वास्थ्य प्रतिष्ठानसँग बसेर लामो सहकार्य उपलब्धिमूलक सहकार्य गरियो
यो एजुकेसनले काउन्ट गर्दैन रहेछ। विषादी भनेको विषादी हो, विषादी भनेको त्यो मार्ने नै हो। त्यो कहिले पनि त्यसले बचाउँदैन, एकछिनलाई बचाएको जस्तो गर्छ, एकदिनलाई हरियो बनाएको जस्तो गर्छ, एकछिनलाई राम्रो देख्छ, तर अन्तमा गएर त्यसको असर चाहिँ कहिले पनि बचाउने हुँदैन, त्यसले चाहिँ मार्ने नै हो। जबसम्म हामी सबै एकै ठाउँमा आउँदैनौँ, एउटा विषयवस्तु एउटा गोल निर्धारण गरेर हामी सबैले मिलेर काम गर्दैनौँ तबसम्म हाम्रो काम चाहिँ सफल हुँदैन।
राजनीति गरेर आएको मान्छेको हिसाबले यो विषयलाई हेर्दा मैले कसरी हेर्छु भने हाम्रो संविधानमा एउटा खाद्य सम्प्रभुता भन्ने कुरा छ। त्यो ऐनको आत्मा चाहिँ के छ भने नेपालका हरेक नागरिकलाई पर्याप्त, पोषणयुक्त र गुणस्तरीय खाद्यको अधिकार छ। आवासमा यस्तै हुनेछ, शिक्षामा यस्तै हुनेछ, स्वास्थ्यमा यस्तै हुनेछ, कामको अधिकारमा यस्तै हुनेछ। 5-7 वटा लाइन होला नि, यस्तै राख्ने हो भने समाधान पूर्ण हुन्छ भन्ने लाग्छ मलाई चाहिँ।
हाम्रो थुप्रै पहिचान छ, हामीले गर्व गर्नुपर्छ। हाम्रो एभरेस्ट हाम्रो पहिचान छ, बुद्ध हाम्रो पहिचान छ, र सायद एक दिन यो विषादी मुक्त देश पनि हाम्रो पहिचानको एउटा पाटो हुन्छ कि।
2 days national conference on pesticide and health was organized with the theme Multisector Partnership for Healthy Farming, Healthy People Through Reduction of Pesticide Use. This conference was an attempt of the foundation to provide a platform for stakeholders to discuss and develop integrated plans to ensure better public health through rational use of pesticides in farming. This was a unique platform where stakeholders from the various sectors and of all levels, federal, provincial, local, came together to discuss on the important issue by sharing their knowledge and experiences. On 10th of January, first session was based on pesticide use and its effect. Co-chair of the session were Dr. Meghna Thimal and Professor Dr. Sunil K. Joshi. Ms. Simran Kafle of FHEN and PHF presented her paper on situation analysis of pesticide use and health effects in Chitwan district. Mr. Ramcharitra Shah of CFED presented his paper on nexus between climate change and pesticides. Dr. Rakesh Ghimire, Principal Investigator of Hope Grid, spoke on pesticide-related suicide in Nepal. Ms. Prakriti Sharma, Project Officer of NPHF, presented her paper on Association of Pesticide Exposure and Pregnancy Outcome. Lindsay Jacks of Harvard T.H. Chan School of Public Health spoke on human biomonitoring of pesticide exposures in South Asia. The second session was based on multi-sector responses to minimize pesticide use. Co-chairs of this session were Professor Dr. Bandana Pradhan and Mr. Shri Krishna Upadhyay. Mr. Sunil Dulal, Senior Agriculture Officer of FHCN and PHF, shared his presentation on intervention in farming sector of Chitwan, the FHCN experience. Mr. Pramesh Koju from Dhulikhel Hospital spoke on pilot educational intervention to promote safe pesticide use practices among farm workers in Nepal. Ms. Meena Pokharel expressed her views on pesticide reduction experience of the Small Farmers Association. Ms. Simran Kafle, Dr. Avinav Vaidya and Ms. Usha Nupani of FHCN and PHF addressed the issue of pesticides in the health and education sector, the FHCN example. Third, or the last session, was based on advocacy and policy implications for health. Co-chairs of this session were Dr. Yuvraj Sangrola and Dr. Dilli Ram Sharma. Professor Dr. Sharad Onta, founding member of NPHF, expressed his views on need of advocacy for pesticides. Mr. Parshuram Adhikari, Chief of Plant Quarantine and Pesticide Management Center, spoke on policy issues in pesticides in Nepal. Mr. Jyoti Bania, Advocate Supreme Court of Nepal, spoke on Pesticide Act and consumers' perspectives. Ms. Simran Kafle of FHCN NPHF presented advocacy process and experience from Chitwan. Every session were closed with discussion and fruitful conclusion. Dr. Mahesh Maske summarized the session on the closing session of conference. Likewise, Professor Dr. Sharad Onta paid vote of thanks.